I'd like to tell you about the study Priorities in the Primary Care of Persons Experiencing Homelessness, published in 2016 in Patient Preference and Adherence. There are over 500,000 Americans homeless every single night. People who are homeless often need primary care. They have high rates of chronic medical and mental illness. This is increasingly an older population with complex needs. Mortality rates are very high. Today, there are two U.S. departments, Veterans Affairs and Health and Human Services, that fund over 300 programs to offer primary care to homeless people. But there has been little effort to learn if that care is optimized for their needs. Is it truly patient-centered? We decided to ask homeless patients and experts in their care what aspects of primary care matter most. We were curious if patients would have different priorities from providers who have focused on caring for them. To do this, we pulled together a list of 16 potentially important attributes of high-quality primary care. We called the list from two reports from the Institute of Medicine, one on defining primary care, another on improving the quality of health care. Potential attributes on the list ranged widely. They included accessibility of care, to cooperation among caregivers, to the idea that care should be safe but not wasteful. We rephrased each priority as a simple value statement that we could put on a card. For the idea that primary care should be accessible, we phrased it as primary care should be easy to get. For cooperation among caregivers, we phrased it as primary care should mean all of those who take care of a patient should work as a team and talk to each other. The result was a deck of 16 easy-to-read cards. We sent these to 17 organizations that serve homeless patients and 19 expert homeless healthcare providers. We asked them to rank the cards based on what they thought was most important. 36 decks came back. Providers and patients both gave high priority to some concepts: accessibility, care based on the best evidence, cooperation among caregivers, coordination of services. However, there were also some interesting differences of perspective. Expert caregivers put high priorities on patients having control in their own care. Among the caregivers, its mean rank was 4 among 16. Among the patients, the mean rank was 10. But people differ a lot in how they rank these things. Visually exploring the response pattern on the left shows that patients varied a lot in how they rated control. Providers clustered rankings for this in the top half of their rankings, as you see on the right. In a subsequent study, we learned patients often don't feel comfortable with the idea of controlling their care per se. On the other hand, patients put a high value on shared knowledge and free flow of information. This meant they gave it a mean rank of 4, while expert providers gave it a lower rank of 10. What does this mean to us? Patients and providers both want care to be accessible, evidence-based, coordinated, and cooperative. Providers may be overestimating the value their own patients place on control per se. What patients seem to say here, and in a later study by our team, is that they want to be included and fully informed. For agencies that wish to advance homeless primary care, we believe this study sends a signal. Services need to be designed to match what the patients themselves tell us matters most. If we allow primary care's quality to be defined generically, based solely on disease-based metrics, we could do vulnerable populations like the homeless a disservice. The research here was supported by the United States Department of Veterans Affairs. The views here are my own and don't represent positions of any department of the United States government. A validated patient experience survey for homeless patients is freely available for any who are interested and wish to contact me. Thank you so much.